everyone for joining us this evening, recognizing that the days are a little longer and that it's really tempting to be outside or spend some time in the daylight. We have a few topics for you today, but before we get to them, we'd like to allow the opportunity for folks who are with us who need interpretation to do so. If you are joining us and need language interpretation to Vietnamese, Cantonese, Spanish, or Russian, you can select the little globe icon and it will give you the list of languages that we have available. We also on the Zoom link have ASL interpretation. If you're joining us through Facebook, that might not be visible, but you are welcome to click on the link there to join the live Zoom call and have access to the languages and to ASL interpreter as well. Our agenda for tonight, we have three main discussion points. The first one will be an overview of the suspension and expulsion prevention program, an update to be more precise. Second, we'll give a quick update on the DELC branding. As we know, we're on our way to transitioning to DELC, so we'll be giving a quick update about this. And then lastly, agency and program updates. And so we have a few different topics to cover in that as well with along with some awesome slides and visuals. So as always, we'll make sure to allow for time for questions after each topic, and you can add those into the Q&A box that is on your screen. Should find at the bottom of your screen, and it's kind of like two little message boxes. It just says Q&A. You can drop in your questions in there and we'll go ahead and answer those as we can. If you're on Facebook, we'll also check the comment section for questions that might come up there and address those during the live webinar as well. With that, I'd like to pass it on to my colleague, Katrina Miller, who's joining us this evening. Welcome back. Actually, you were with us a couple months ago to share about the Early Childhood Suspension and Expulsion Prevention Program.
Thanks so much, Karina. Yes, it's great to be back here joining you all this evening. And to share some updates on things that we've been working on, things that are coming ahead of us. So let's go to the next slide. So as many of you are probably aware, there were a couple of bills that were passed during 2021 related to suspension and expulsion. And the first one that I really want to highlight is one that not everybody's been aware of. And that is this House Bill 2166, which created this early childhood suspension and expulsion prevention program. And with that, a variety of services and supports. We're bringing in an array of services and supports, things that have not necessarily been available or haven't been available across the state in the past. So that is, I think some people have not really heard as much about what's coming. So that's what I'm hoping to share more about tonight. We have a partner agency who is working with us on the development of those supports and services. That's Trauma Informed Oregon. And I will talk more about them a little bit later and some of the activities that they're going to be leading, some community engagement that will become available before long. So another thing that we're working on right now is a research study on the use of suspension and expulsion in Oregon and efforts to reduce suspension and expulsion. How much is it happening? Where is it happening? What's leading up to it? Kind of digging into helping us understand what's happening. What are the supports that providers need and want to be able to support children? And we have a partner who is working with us on this, and we're very close to a contract with them, which I'm very pleased about. And that's the Coalition of Communities of Color. So you'll hear more about them in the coming months and the work that they'll be doing. And then later on down the road, there's the ban on suspension and expulsion doesn't come into effect until July of 2026. So I know there's a lot of fear, a lot of nervousness about what that means. We fortunately still have some time to really build those services and supports and get them out into community to provide the support to you as you work with children and families, provide supports for children and families. All right, let's go to the next slide. So some guiding assumptions, kind of things, this is based on things that we have heard from you as providers and things that we have read and heard from other states, from research that's been done. But starting with, we've heard you tell us loud and clear, caring for young children is hard work. We know it's usually underpaid and it's under-supported. There aren't enough supports to go around for providers. And we want to provide those supports. I think anyone who has worked with young children or has parented young children knows young children present us with challenging behaviors or behaviors that can be challenging for us as the grown-ups to deal with. Young kids, they hit, they kick, they bite, they cry, they scream, they won't sit still at circle time. They present us with all kinds of things that keep us on our toes. And that's true for one parent with one child. It's also true for providers who have 4 children or 8 children or 20 children to care for all at once. So some of those exact behaviors, because of those challenges, result in children getting suspended from their classroom, their program, or expelled. And even behaviors that are developmentally appropriate for the child or for the child's age can still be experienced as really challenging in the classroom environment. So we know children get suspended and expelled because of those behaviors. We also know, and research has been really clear in telling us this, that children who are Black or brown are more likely to be suspended or expelled for the same behaviors as their white peers. And children with disabilities are more likely to be suspended or expelled than children without disabilities. So we put all of that in the context of knowing that the care that young children receive, their early education settings, it impacts their early development. And that early development has a lifelong impact. So the work that you are doing right now makes a difference to children for the rest of their lives. So we want to make sure that children have access to those good, positive early learning environments. But we know to do that, people need support. Everyone needs more support. The children need more support, families need more support, and you as the providers need more support. So this program is intended to provide those supports, to really bring those in and add in services and supports that have not been available in the past, and to make sure that the services and supports that are available are tailored to help prevent the challenges that come up that result in suspension and expulsion. Let's go to the next slide. So I'm just going to talk briefly about this visual, and then the next slides will go into this, into these quadrants in more detail. I'm going to start the lower left where it says coordinated system of support. We want to We want to make sure that there's a way for you to access support and services when you need it. And we want to make sure that those services are coordinated with each other. So you're not getting differing messages from different people. We want to work with our training and technical assistance providers, people who work in CCR&Rs, coaches, other people, behavior specialists at Head Starts, early Head Starts, anybody out there who is providing support to you as providers. We want to make sure that those folks are ready and prepared to support you. So that leads me to training for you and additional training and support. And I'll say more about that in the coming slides. So I'm just going to mention that for now, and then say infant and early childhood mental health consultation. I know some people are probably familiar with what this is. Some people, it's probably a mystery. It's not currently available all over Oregon. It's only available in a few places. So we're going to be building access to that. Next slide. Thank you. So again, I'm just going to, briefly, we'll touch on these 4 things in the next 4 slides, the warm line and coordination. I should say these 4 things in the next 3 slides. The warm line and coordination, training and technical assistance, and the infant and early childhood mental health consultation. So the coordinated system of support, there's kind of 2 big pieces, and probably more than 2, but there's 2 big pieces that we have here. One is this idea of a warm line. We're creating an online access point for you to be able to go and input a request for support. It might be a situation where you have a toddler in your care that is biting a lot, and you want some support in figuring out what are the strategies for supporting this child and keeping, we all know biting isn't fun, making sure that other children aren't getting hurt. Or maybe you have a child that has been in your program for a while, but something happened. Maybe a parent moved out of the home, or the family transitioned to new housing, or there was some type of traumatic event that happened in the child's life. But suddenly this child is experiencing more distress. This child is experiencing more behaviors. Children show us their distress a lot of times through behaviors. And so there's now new challenges to deal with. And so what we want to have is an easy access point where you can put in that request and say, I'd like some support supporting this child or dealing with this situation. So coordination. So let's say that you put in that request for support. What happens if we have 2 or 3 or 4 different people respond to you, and each person is giving you a different message about what the solution is? That's not a very good setup for anybody. So what we want to do is create a system that does a couple of things. First of all, it will identify who's the best person to provide that initial response to your request. And there could be any number of different factors that go into that depending on the situation. And then in addition to that, if there is a time when we need to have 2 or 3 people who are responding and supporting you, how do we make sure? What's the behind the scenes way that there is communication and coordination happening between those technical assistance providers to make it as smooth and as helpful as possible for you? So training and technical assistance. So there's a couple of things. Well, again, I say a couple of things. It's probably more than a couple. But we want to make sure that the people who work for CCR&Rs, the people who work for other organizations that support you as providers, we want to make sure that those coaches have the support that they need to help implement practices related to promoting inclusion and preventing suspension and expulsion. And one of those strategies that we are looking to expand is support for implementing pyramid model. There's a lot of flexibility within that. There's a lot of other possibilities, but I know that pyramid model has been something that a lot of people have been curious about and ask for more. So basically, we want to make sure all those technical assistance providers can provide the best possible supports for you. So training for early childhood educators. I know you already have a lot of training that you go through, and we're not trying to, make things more overwhelming in terms of amount of training, but we want to make sure that the trainings that you've told us that you need more of are available. And so one of the things we've heard from you is more support on navigating social emotional development, managing behaviors. And so some of the possibilities, these are just some options, some possibilities that may come your way, and more. So pyramid model training, strategies for teaching social skills to young children. And social skills, there's a lot of different things that fall under the heading of social skills that includes something like potty training, or how to line up, or how to do transitions. I know potty training has been a big challenge for a lot of people at this stage of the pandemic. Teaching emotion regulation and anger management. Some of you may be familiar with Tucker Turtle. There are also other strategies for helping kids who have big feelings learn how to calm down. Sometimes helping ourselves to calm down. Teaching friendship skills, how kids can make friends with others. Managing developmentally appropriate behaviors, particularly when we think about taking children, a whole group of children, and putting them in a group together, right? What happens with managing behaviors during that setting, which is what you deal with, what you navigate every day, all day. Connecting with families, navigating difficult conversations, so important and challenging. And also supports for supporting children with disabilities. Making sure that you have the training, the support that you have been asking for, that you would like to have around helping all the children to be successful. And then infant and early childhood mental health consultation. This is a model, it's a service that is an adult, a mental health consultant will come alongside you as a provider to provide support. Sometimes it's the person who can just hear you say, this is really difficult work. It's also, the mental health consultant is also somebody who can help design and provide individualized supports for children. It's about helping build your own skills and capacity around managing all of these difficult and challenging things. And really, truly, somebody to just kind of come alongside you and walk with you in navigating how we get through this particular challenging situations. So it's in development. It's not going to be available right away, but it is, we're working on it. It will be coming in, hopefully in April. We'll be releasing a an application process that will be our first step in making sure that it's available statewide. But it will be, I've had people ask me from the rural areas, but will it come to our area? And yes, it will come to your area. If you have a need, if you're experiencing a situation currently where you need some support related to a specific child, these services aren't in place yet. Reach out. So what you can do in the meantime is reach out to inclusive partners, reach out to your local education service district or the early childhood special education program in your area. Also reach out to your CCR&R and ask for support, ask for help. And sometimes even if the person that you get doesn't know the answer themselves, they can help provide additional phone numbers or direction to people who can provide more support. I think, is there another slide or is that it? Oh, yes. So coming soon, our partner, Trauma Informed Oregon, will be leading a community engagement process. And this is April through June, but really we're looking at kind of starting probably more the second half of April, going through June, but really it's more like the beginning of an ongoing process. So it's not like everything's going to like stumbling over my words. It's not like community engagement will just stop right at June. We're going to continue on over time, gathering more input, seeking your feedback on how it's going, and what else you need. So watch for that. The other thing that Trauma Informed Oregon will be doing is convening a community advisory group that will help provide guidance in the development of the suspension and expulsion prevention program and all of the kind of array of supports and services within it. And again, that's probably going to start happening more towards the end of April. So keep an eye out for an application opportunity towards the end of April, beginning of May. And then finally, the piece I mentioned a little bit ago, we will be releasing a request for proposals for what we're calling regional service providers. And this will be the process to select the organizations, an organization in each region to provide to be the mental health consultation provider for the region. So all of that, as we have, I don't have the exact details beyond this to share with you tonight, but what I can say is that when those details are available, they will be posted on the suspension and expulsion prevention webpage. So the links to the webpage have been shared in the chat. And also, if you scan this QR code, it will take you to the suspension expulsion webpage. And I think just after this is my contact information, unless I'm forgetting. Yep. So feel free to reach out to me individually or keep checking back to the website because there will be updates there. And yeah, I think that's what I have for this evening.
Thank you, Katrina. I'd like to pass it on to Ronnie, see if there are any questions that might have come up or anything that we might need to reiterate.
Okay, Katrina, we do have a question and it's a long one. So
okay.
it says, what accountability are parents of these kids going to be held to? What training and help are they required to seek? Why do so many things coming our way feel like they're to support only parents and simply continue to weigh down the plates of those who have already stretched so thin? And basically, they want to know about what guarantees are there in the field for those working in the field so that they can go through the steps and the system doesn't get bogged down while they're waiting as they're trying to seek that support.
Mm-hmm. Yeah, that's a really good question. And of course, a very complex question. Or the answer to the way that we try to answer it as a system is very complex. So the early learning division, the way, just kind of the way it's set up, like we can't mandate parents to participate in any given thing. There is parent choice in participation related to services for their child. That being said, I mean, that's like full stop. It's parents have choice. Parents are it's their child. They're allowed to make those choices. But I think the piece that we will figure out over time, and I would invite your participation over time as we delve into these questions of what does it mean if we, as a program, if the suspension and expulsion program and the early learning system as a whole, we say we would like to provide some supports and the parent declines, then how can we still provide support to you as the provider in a way that is meaningful for you? And I don't have clear answers to that and what that means, but it is a question that I'm aware of and holding in mind, and know that we will need to work through that and think through that carefully, because we don't want to, it's not a, we don't want to force anybody my thoughts are going too fast. We don't want to, we can't require parents to participate. We would like to invite them to participate. We do also want to provide support for you to help you be as successful as you can in your role as provider, and to not feel like you don't have the capacity or what you need to be able to support a child. So I think there will be a lot of individual conversations as well over time about what those look like and how we navigate those situations.
A response came back that says, but we're being required to keep them in our programs.
Well, the good question. So right now, there is currently no requirement. There's no ban on suspension and expulsion currently. When we get to 2026, that is what the legislation tells us, is that suspension and expulsion will no longer be allowed. That doesn't mean that every single child will stay in exactly the same spot that they are. So there may be some time to, there may be a process to go through so that there's a supportive transition. If the current placement for the child isn't supportive or isn't, sorry, I'm getting distracted. If the current placement for the child isn't working and isn't the right place, then we'll have a strategy for what we call a planned transition. But a lot of those details are still to be worked out over time. But great question.
Thank you, Katrina. I appreciate you being back and sharing this information. We know that there are lots of questions, and like you said, there is still time for this program to be developed, and we just want to make sure that folks are informed of where that stands in the process and aware of what to expect, and that this way you'll lean into the opportunities for conversation and engagement as those come up. That's going to be really important. And we want to make sure that folks have that opportunity and space to do so. So appreciate you. I'm certain we'll have you back at some point.
Thanks, Karina.
This is of high interest and of high importance. Thank you, Katrina. With that, we'll move over quickly to the branding update. And this is trying to navigate screens here. This here is with the transition to the Department of Early Learning and Care coming July 1st. We've worked for some time with a firm, Madison Avenue Collective is if anyone was interested in that, but we worked on it with a firm to help us develop the DELC's visual identity guide. Sometimes it's called the style guide. This is just kind of the visual image of the new Department of Early Learning and Care. And so here is the color palette and then the logo that you can expect to see in the coming months. So the colors on the right, the blue, the red, orange, the yellow, and then the logo and kind of different blends depending on the colors that are used. Do want to note that the background, here that you see kind of the shapes and the pink in the background, that's not part of the color palette, but right now it's serving as a watermark. So instead of just saying, draft, it has these macaroni and circles and squares in the background to serve as a watermark. So that's not part of it, but wanted to share with you the new logo, the new color palette that will be coming up. There was some engagement with that the firm supported and did, and just got feedback on what community and providers and partners would like to see in this logo. So this is what was built off of that information. We are still in the process of creating a toolkit to assist different partners with any updates that might still need to make, but wanted to just take the opportunity to share this, open to questions if necessary. Dawn Taylor has been with us in the past, and I know that she has shared about some of this information. She wasn't able to join us this evening, but wanted to make sure that we shared at least the sneak peek of what is to come with the visuals for the Department of Early Learning and Care. Kind of nice to just see a new colors, new image, and a little more branding around the transition. All right. Well, I don't see questions. I'm assuming nothing on Facebook either. Just a reminder for anyone who's joining us through Facebook, we're also watching the chat there if there are any questions or comments. With that, I'll go ahead and transition over to general agency and program updates, and Allison and Remy will take it from here. Thank you.
Thank you, Karina. Go. Okay, so we wanted to make you all aware that we have a Certified Center Rules Advisory Committee coming up. And Karina, if you don't mind going to the next slide. The call for participation is here. So a rules advisory committee is going to help develop new rules for certified centers. And the application just opened on March 20th. It will close on April 14th. This is a great opportunity if you've been joining us for these information sessions, or if this is your first time. We really want to hear from community and have your voice as a part of the conversations as we develop the revised certified center rules. There was a work group earlier this year, and the RAC, as we call it, will help kind of finalize things as we get ready for a launch. So I'll put links to all of these agency and program updates in the chat as soon as we wrap up. Go to the next one. Thanks, Karina. So as Karina said, looking at that branding, we are becoming the Department of Early Learning and Care on July 1st. And a part of that transition is the ERDC program will move to our new department. And as part of that process, we are expanding the program. And as eligibility expands for families, we also are trying to recruit more people to become ERDC providers. So we have a few slides highlighting some of the recent changes for the ERDC program. So the first recent change, providers have the option to bill at the beginning of the month. And that switch to enrollment-based pay will mean that payments are a little more predictable and reliable. So previously you had to bill at the end of the month, but you don't need to do that anymore. You go to number 2. If you're already licensed, and we know we may have some license exempt folks on the call, but if you're already licensed, all you need to do is fill out a provider listing form. It's very simple. Again, I'll put this in the chat. And then you could be serving eligible families in just a few days. Number 3, the ERDC program is a subsidy program that helps low-income families access childcare. We know that's important to us, that's important to you. And it's also a program where you can be a program grantee. So you could be an equity fund grantee, a preschool promise grantee, and also serve ERDC families. And the direct pay unit is available to support through the listing process. So if you have questions, contact information will be at the end of these slides, but you can reach out to them and they'll also offer ongoing support. And lastly, touched on this earlier, but there are recent eligibility expansions as of January 1st. So students are now eligible for ERDC, families are eligible for more hours, and really just a lot more people have access to the subsidy program. So it would allow you to keep children in your care and reducing the burden of childcare costs for families. There may be families that you're currently serving that weren't eligible, but now could get that subsidy. And contact information, this is the DPU customer service email. I'll put this in the chat. And I think I will hand it over to Remy now to talk about Raise Up Oregon. Thanks for being here, Remy.
Hey everyone, good evening. My name is Remy Watts. You might remember me. I came on like probably close to a year ago just to talk about what Oregon administrative rules are, and dropped that link in the chat for anyone who's interested in applying to that Certified Center Rulemaking Advisory Committee. I am not on that project, unfortunately, but the colleagues who are running it are very fun. So hopefully y'all will have a good time. But I'm here today to talk about Raise Up Oregon, which is our system strategy plan, which I will explain a little bit more. And we can just skip to the next slide, especially because that deadline, I just realized literally right now that the deadline in our PowerPoint is incorrect. Sorry about that. It's actually April 30th. So just really quick, Raise Up Oregon is, it's basically a to-do list that our state agencies have put together of stuff that we want to get done that will support families with young children. And that includes childcare providers. So supporting childcare providers is a pretty large part of what the action plan looks like. You'll see yourself in it quite frequently if you go through and read it. So we've had Raise Up Oregon, the first edition. Let's see if I can find my emergency copy. Here's my emergency copy of Raise Up Oregon first edition, if anyone has seen it before. It was 2019 to 2023, and all of a sudden it's 2023. So we've got to redo our to-do list so that we can look at what we've gotten done. So we've gotten a lot of stuff done from that first plan. And now we're going to look at everything that we got done, look at the things that we still want to do from the first edition, and then add on to those things. So that's why we're making our Raise Up Oregon second edition. if some of you who have, I've gotten a couple of comments so far in the webs or in our web comment who are saying, we haven't finished the first edition. Why are we moving on to the second? And I want to make it clear that we're taking the stuff that we didn't finish in the first edition and moving it into the second. So there's obviously so much to do, and we're really excited to continue our work that we started with the first edition of Raise Up Oregon. So if you'll look, it's the state's plan for the early childhood system, which is just a really fancy way of saying anything that a child and a family with young children needs to be happy and healthy and to focus on their education. So you'll see we've got the housing, we've got public education, we have health, human services, which is, child welfare. So we've been working with people from all those different state agencies to make this plan a reality, and now coming up with a new plan. And we can move on to the next slide. Thank you. So now we've got this big draft of the second edition. We've gone through, we got a lot of people to tell us a lot of things about how we should write it. We've written our first draft, and now we're doing a lot of different types of engagement. So I'm sure y'all are familiar with early learning hubs. Some of you may have been tapped by your early learning hub to do some more focus groups. We've got focus groups going on through our early learning hubs who are talking to families and providers who are usually kind of more difficult to reach, who wouldn't respond to our website that we have open. And then now we have this big website that we've opened up where you can go and read the plan and read everything that we have going. And then also there's a form where you can send your feedback and your comments, which is, I hope that you'll think the form is pretty cool. I hope that you'll go and use it. I am reading every single comment that comes in on that form. This is not the first time I've done something like this. I am very used to reading hundreds of comments that come in, and we're going to take out all of the different pieces of information and put it into the plan, or figure out where else we can put those comments. So you'll see, I believe Allison just put it into the chat. Raise Up Oregon, there's the link. You can find the plan in 6 different languages, as well as the feedback form. If you're interested, there are also some communications toolkits where you can print out a flyer and put it in your childcare facility for parents to scan the QR code, and they can tell us what they think about the plan. We've got social media posts if you want to go that way too. Would really appreciate your help spreading the word on this. But I would love it if you would take a little bit of time and just look at the plan and look at these questions that we've got up. How can Oregon better serve young children and families? Does this plan address your priorities, address your community's priorities? What is right? What is missing? Is there anything that you really want to ensure makes it into the final plan? And then, of course, your input will help shape the actions of all of our government agencies, especially the Department of Early Learning and Care. So it's a very exciting opportunity to build a new roadmap for the next 5 years. And if we can go to the next slide, please. Thank you. There's the QR code that I'm talking about. My comms team made really fancy QR codes. I guess QR codes are a thing now after the pandemic. And you can just go, click, provide the feedback, give as much or as little information as you want. We have extended the deadline. It's not April 14th. I'm sorry about that. It's actually Sunday, April 30th. You have until the end of April to get your feedback in. So plenty of time, over a month. And if you have any questions, of course, you can ask me right now. Let's see if we've got any questions and answers. Not yet. Drop them in the chat. My information is there. So you can feel free to give me a call, give me an email, and I can talk more about what a system strategy plan is, system strategy plan. It's a funny phrase that means a lot of very tangible things. But we'd love to get your feedback, and we'd love to hear from you, because we really are trying to make, a collaborative future in Oregon, and we really want to hear from you to do that properly. So I will wait for a question to drop in the chat. Otherwise, I think I'm done for this evening. Cool. Okay, well, thanks for listening. I hope that you give your thoughts on the new Raise Up Oregon. We're planning to publish it in June, and then we'll start implementing it next year. So very, very exciting times. And thanks so much for having me. I always love coming to these things and connecting with you guys. It's great.
Thank you, Remy. So appreciate it. And we'll make sure to make those updates on the slides before we upload them to the website. That way, if you would like to see them or share them with others, you'll be sharing the correct information, and apologies for that again, but it tends to happen. Thanks, Remy, for that. I'll ask Ronnie if there were any questions or comments that might have come up, or Al, if we saw anything come through Facebook, but I just want to give a minute for anything we might have seen.
There was just a question around the link to the rack, and Remy put that in the chat.
Great.
The Q&A. And I believe Allison had also put it in the chat. Yes. That's to the Child Care Center Rule Advisory Committee.
Perfect. Well, thank you. And we will make sure to, the links are embedded in the slide deck if anyone wants to go through and find the links as well. But our webpage can also find the different links on our webpage. So we'll go ahead and make sure that we upload this recording to our webpage where you'll be able to find it. You can also access it through our YouTube channel and share it for anyone who might want to go back and listen again, or if there's anything that you'd like to highlight to any colleagues, please do so. We want to make sure that folks have that opportunity. And with that, we'll go ahead and close for the evening, but we'll see you again in April and May. So we're doing these sessions again every other month, and keeping that pace for the meantime. So thank you for joining us. Hope this was of help for you. And we do have a closing survey here as you log out tonight that we'd appreciate you responding to and giving us any feedback or suggestions for future topics that would be helpful and informative for you. Thanks, Al, for dropping the chat where you can find previous recordings as well and slide decks. We also have the slide deck available in Spanish there. We had our Spanish recording, our Spanish session yesterday, so you can find those there. If not today, then tomorrow we'll make sure that we have our communications team updating those. Well, thank you all, and we'll see you again in 2 months' time.